It's The Real News. I'm Aaron Mate. Senate Republicans have renewed their effort to strip millions of their health insurance and hand a massive tax cut to the wealthy. But after voting to open the debate, the first repeal and replace bill failed to receive enough support. The Senate will take up several more proposals to undo Obamacare in the coming days. But even if they fail, President Trump has already previewed his health care plan going forward. Let Obamacare collapse on its own.
I've been saying that, Mike, I think you'll agree, for a long time. Let Obamacare fail. It'll be a lot easier. And I think we're probably in that position where we'll just let Obamacare fail. We're not going to own it. I'm not going to own it. I can tell you the Republicans are not going to own it. We'll let Obamacare fail, and then the Democrats are going to come to us and they're going to say, how do we fix it? How do we fix it? Or how do we come up with a new plan?
One way Trump could do that is refuse to make the subsidy payments to insurance companies who cover Obamacare recipients. The White House has made those payments for July, but hasn't made a commitment beyond that. So what does the future hold for Obamacare and the health care fight? Well, joining me are two guests. Dr. Bill Bronston is a member of Physicians for a National Health Program, and Dean Baker is co-director of the Center for Economic and Policy Research. Welcome to you both. Dean, I'll start with you. Talk to us about where we're at right now with this Republican effort to repeal Obamacare.
Well, they did accomplish a big step in this effort in getting the discussion going. They brought in Senator McCain, who, as you know, is suffering from serious brain cancer. Not a good story for him. But in any case, he came to Washington, cast the deciding vote, so they're starting that. Now, the question is, can they get anything approved? It seems their strategy at the end of the day is just get something voted out from the Senate. Then they'll go to a conference committee, and then they'll say, here it is, and basically do everything they can to lean on both the members of the House, because they have to get reapproved there, and then get their 50 votes in the Senate with Pence casting the deciding vote. So whether they could do that or not, who knows? But they obviously think they have a shot, or they wouldn't be doing this.
And President Trump's suggestion that he wants to just let Obamacare fail, do you think he's being serious there? And if he is, could that include not making these critical payments to insurance companies that cover the subsidies for Obamacare recipients?
Well, he could well be serious, and we should just be really clear. He's killing it. You know, it's kind of like if I have someone in my house, I lock them in a room, and I give them no food or water, and I go, well, I'm just going to let them die. Well, no, I killed that person. That's what we're talking about here. So part of the Affordable Care Act is the subsidies for the insurance companies to provide lower-cost care to moderate-income people. Part of the story is having the mandates. He's talking about not enforcing the mandates, so people won't buy insurance if they don't feel like it. They'll wait till they're sick. That's a great way to destroy the market. And of course, they'll do nothing to promote that. As I understand, if you call health.gov, they tell you about how bad Obamacare is. In other words, you don't get information about the system. So they can kill it, and he may well try to do that, but we should just be clear. That's Donald Trump killing the Affordable Care Act.
Dr. Bill Bronston, you're with Physicians for a National Health Program, and as the name suggests, you want to go beyond saving the Affordable Care Act and actually instituting single payer. Your sense right now of where things are at?
We're facing, without question, the greatest assault on behalf of the 1% against the 99% conceivable in our society. Health care in America is not for sale. All that's for sale is our hostage and ransom relationship to the medical delivery system, which is all privately provided in large percentage. So the question that we really have to deal with is whether or not the people of America will understand that unless we have a universal, rightful healthcare delivery system that is essentially aimed at providing a single tier of care that excludes nobody, that is based on prevention and early intervention, that includes dental care, visual care, rehab services, long-term care, and that covers issues of workers' comp and health benefits, all in one package, that we will have continued profound suffering and a profound discombobulation of our society. The 1% is being spoken for by Trump and his minions. All that will fail in Obamacare is the loss of insurance companies who are jacking up the general public and the government in order to increase the money that they would be getting. We don't need the insurance industry, and single payer would outlaw the entire private insurance industry completely from the marketplace, leaving a private delivery system in place in America, but a public payer that would provide us with the most profound transformation, a paradigm shift in social policy and in the lives of Americans imaginable.
So, Dr. Bronston, where do you stand then on what the Republicans are currently doing? Do you think it's acceptable to let Obamacare fail, as Trump wants to do?
They're criminal. And the issue is whatever happens at the federal level, the state of California, as you know, has generated through its Democratic leadership Senate Bill 562, which is to establish the most advanced single-payer system so far that we have seen. It is a brilliant, simple piece of legislation that essentially takes advantage of the fact that every single dollar needed in delivering medical care is already in the pot. We have to raise not a single new dollar. What has to happen, and what is proposed in this particular piece of radical legislation coming from the center Democrats, is two small taxes that would completely replace all insurance premiums, all deductibles, all copays, all fees. People would get a health card. They would essentially pay their state and federal taxes as they do now. There would be two small taxes that would be added, one for gross receipts for business, one for families at a very low level with some subsidies involved. And there would be no more out-of-pocket expenditures whatsoever for the people of California, including all residents of California. That means total comprehensive coverage for everybody for approximately 20 to 30 billion less than we currently pay, and we still don't cover close to 20% of the population, either a result of no insurance or underinsurance. It's criminal.
Dr. Bronston, you talk about what's happening right now in California with the efforts to establish a state universal healthcare system there. I've always wondered, though, with these efforts, are they sustainable in the absence of a federal national program? Can a state, whether it's California that's trying it now or Vermont that's tried it before, can a state sustain a single-payer program on its own?
The question is, can democracy prevail in a totalitarian corporate culture with Citizens United and that kind of corruption? The question that you're asking has to do with the future of America. It isn't the issue of a finite healthcare delivery system. It has to do with all of us. The question is whether or not we can, through mobilization, democratic mobilization of the public in America, defend and advance something which is a matter of life and death for us. Now, the opposition has limitless money, and they understand what the issue is. This is not about dollars. If this was about dollars for the 1%, we'd have had single payer 50 years ago. It is not in the interest of the corporate community to have the kind of costs leveled in it from its own brethren, its own corporate brethren that are essentially the middlemen.
Dr. Bronston, I understand your structural critique, but I'm asking you, at the state level, is a plan like this sustainable? Is it feasible? Even if it's laudable, is it sustainable?
The answer is absolutely yes, because it's a political question. It's a question that has to do with working through negotiations, through elections, through representation, through legislation. The solution to this problem, it's not like throwing a switch. We have a major challenge because for 100 years, we've had a system that has been totally drawing blood from the American public.
Okay.
And the question of changing it over is the challenge of the day. It's not magic, and it's going to require awareness. It's going to require organization. But I tell you absolutely that it is feasible, and it must be done if we are to survive as a nation.
Okay, Dean Baker, your thoughts on this approach of pursuing single payer at the state level, as at the national level things are in such chaos?
Well, it's very hard to see how a state could do it by itself. It could be conceivable if you had a friendly administration in Washington, and of course you don't. So they're counting on two big pots of funds, the Medicare and Medicaid pots, going to the single-payer system, which I feel comfortable that Donald Trump will be not turning those over. But even apart from that, once push gets to shove, there's a lot of issues that are not resolved. So, for example, a lot of people like their health insurance. That's fine if you don't, but they do. So you have to tell those people that they could keep their own doctors. In many cases, that won't be true because they'll stay outside the system. So, when you actually try to get down to the reality, how does this look? I don't see that happening. I would like to see other steps, intermediate steps. We spend $200,000 a year on new cancer drugs that would cost $200 in a free market. How about an alternative mechanism for financing drug research? Same with medical equipment. Our doctors get paid twice as much as doctors in Germany and Canada. There are no reason to think they're any better than the doctors in Germany and Canada. So there's lots of things we have to do to get our healthcare costs down. And these steps, they could be done with a single payer system, but I think they could also be done apart from it. And I think they open the door for a single payer system down the road.
Dean, do you support Dr. Bronston's ultimate goal, which is single payer?
Yeah, but again, I think you have to figure out how you can do that piecemeal, because the idea that we're going to do that all at once, I literally cannot imagine how that would happen.
So what do you think is the best approach?
Well, I think getting the cost down in the way I was talking about and trying to do things like, having a Medicare buy-in or Medicaid, figure out which is better, or, we have to alter both programs, and doing things like, can we lower the age of Medicare eligibility? Currently it's 65. Can we make it 60? And then somewhere down the road, lower it further. So that would be, I think, the way to get from here to there. I just don't see us doing this in one big step.
Okay, so my question hearing that is, does preserving Obamacare further that goal if it's true that Obamacare, especially through its massive subsidies to insurance companies, helping them stay in business in some ways, keeps the current system going? Dr. Bronston, your thoughts on that?
Mr. Baker is dead wrong, and we represent 180 degrees opposite position. If you look around the world, we are the only advanced society that is in the dilemma that we're in. Every other country in the world, Canada began with Saskatchewan, a single province, and the doctors struck, and it was a major political struggle in order to move the Canadian system into a national healthcare system. If California goes single payer, and California will go single payer sooner or later, the nation will change, and we will add our efforts to the world in order to humanize and to normalize and to democratize our society. The business of incrementalism is the argument of the opposition. It's the argument of the 1%. It sows doubt, it sows uncertainty, it sows fear, and it essentially breaks the heart of the general public that has to understand that it is only through political action, unity, political activism, that we can bring this to bear. The situation is extremely clear. You cannot jump a chasm in 2 jumps. It is everybody in, nobody out, and now is the time that we must make this happen, and we are going to make this happen in California.
Okay, before I go to Dean for his response, Dr. Bronston, I want to ask you, how do you address those who say, look, I mean, sure, I might support single payer, but it's tough, and right now in this country, healthcare is responsible for something like 1/6 of the economy.
Correct. Well, the question of how you talk to people is precisely by offering them a comprehensive solution that has been in the works forever. If single payer were a financial issue confronting the establishment, we would have had single payer 50 years ago. It is not in the interest of the capitalist class monetarily in terms of maintaining this system. So the question then is why? Why does the 1% persist when it is not in their economic interest to have this program? And my contention, our belief, our understanding is that there is a higher political benefit of keeping a society frightened, divided, and insecure to make sure that they are consumer-oriented and to have a sense of hopelessness and quietism in the population. This is a major challenge for us, and California has put together a very simple piece of legislation that for Baker to say is not feasible at a nationwide level because it's coming from one state is absolutely ridiculous and unfounded in terms of any data that we have nationwide. And we have the best data in the country in PNHP.
Okay, Dean Baker.
Yeah, well, I just gave you the data. You aren't going to get the Medicare and you aren't going to get the Medicaid money, and the numbers don't add up then. So I just gave you the data. No, let me finish, buddy. Let me finish, okay?
Let's let Dean
finish. You got a problem with that?
Let's let Dean finish.
Okay.
Yeah.
So
let's let Dean finish. Let's let Dean finish.
talking? Is that your democracy, buddy? Okay, so you don't have the money. And yes, we need to keep people alive. It's not good political strategy to let them die and tell them to wait for the apocalypse. I've been around long enough. I remember the Clinton plan going down in flames in 93, 94. We didn't see a single payer revolution in the wake of that. We saw nothing. I remember having a conversation with Paul Wellstone, certainly the most left-wing person in the Senate at the time. I asked him about healthcare. He goes, "You can't talk about it. You get killed." That was 6 years after the failure of the Clinton healthcare plan. He didn't even want to talk about it. So the idea that somehow if Obamacare goes down, we're going to open the door and single payer is just going to sail through. I stopped taking drugs many, many years ago.
I'm not posing that statement. That's your statement. I'm saying to you that single payer is the only way that this nation can economically survive with a healthcare delivery system. It's too expensive. It's killing our businesses. It's undermining entrepreneurism. It's killing the people, and we don't have an adequate amount of coverage for a giant portion of the population. Obamacare may or may not survive. I don't know. But the talk, the very clear talk from more and more Democrats is that single payer is the most economical, the most humane, the most progressive, and the most necessary reform that has to happen in the United States today.
Okay, Dr. Bronston, let me ask you, even if one shares in your long-term goal, what about the immediate issue of Obamacare? The fact is, it's the system we have right now, and it has expanded coverage to millions of people. Where do you stand on the issue of whether or not it should be protected?
Certainly, the absolute commitment to expanded Medicaid in the Obamacare system and the other benefits of making sure that people are not thrown off insurance from pre-existing conditions and extending the eligibility for children to older age and covering Planned Parenthood and the whole range of specifics that are inside Obamacare are very constructive. However, the system is set up on a corrupt foundation of relying upon the private insurance industry when fully 70% of all the money in American medicine today comes from public tax dollars today. The situation is insupportable, and it may or may not survive, but this is an issue that has to come back to the American people and to the lead organizers. Whether Wellstone was supportive of single payer in the old days, I don't fully know. I don't know where the people in our legislature are. But one thing for sure is the most fundamental reform that has to take place is that the people have to challenge our elected officials, because our elected officials may not represent the interests of the majority of the country. Single payer is the test. It is the absolute litmus test for whether or not we're going to have a democracy or whether we're going to have a totalitarian state. And the ravings from the Trump administration and the kind of criminality that Price represents as the Secretary of Health and Human Services is a cardinal, flagrant example of the terrible situation that we are in.
So
we have to fight back, and California is doing that.
So we have to wrap. So let me ask you, Dr. Bronston, as someone who has been an advocate for a single payer, we've seen this explosion of activism with the Republican effort to repeal Obamacare. And I'm wondering if, as someone who's involved heavily in this issue, you've seen a surge of interest and enthusiasm for single payer at the grassroots activist level in recent months.
It's enormous. I mean, it's the single most powerful mobilizing policy that we've ever had in California. When we ran the single payer proposition in 1994 here in California, we had the largest number of volunteers, the largest number of activists. Now, we lost that proposition 3-1, but we were outspent 15-1. And it was very, very difficult for the people to understand when they're told socialism, gray death panels, loss of doctors. I mean, the stuff that the dean is talking about losing doctors, that's crazy. That's not what's going to happen. People will have free choice of any physician that they will go to, and the physicians will have no intervention in terms of their recommendations. In addition to that, we're going to need some tremendous changes in the country. We have to mobilize and train thousands and thousands of new primary care doctors. We have to deal with the fact that 3 out of every 5 people working in doctors' offices today are essentially pushing paper to make claims happen, and the same on the insurance industry side, where they're pushing efforts to block those claims. all those people are going to be unnecessary and are going to have to be completely funded and retrained into providing health care. The health care movement in this country is going to explode. And the California population, if the bill is progressive and clear and non-incremental, mobilizes the largest number of the electorate ever in the state of California.
Okay, and Dean Baker, as we wrap, I want to ask you about how Obamacare is doing right now as Republicans attempt to repeal it. I think Trump makes a point when he talks about premiums rising for a large segment of people. But what often gets left out, I think, is that many Republican states chose not to take the Medicaid expansion, which could have covered so many more people.
Yeah, well, there's a few points here. First off, the premiums were much lower when the exchanges originally started than what had been projected. So if you go back and look at what the Congressional Budget Office projections were back in 2012 for where premiums would be today, they're pretty much right on target. So that's pretty much in line. In terms of, Trump's made a big point about how a number of counties only have one insurer in the exchanges. That's almost entirely a red state story. In other words, where you have Democratic governors that have tried to make the system work, it does work. If you live in a state with a Democratic governor, less than 2% of those people have only one insurer in the exchange. And one really good measure that I like a lot, people voting with their feet. There has been a huge increase in voluntary part-time employment. Over 2 million people are working part-time, again, voluntarily. They're making that choice. And these are overwhelmingly parents of young children. These are people who, because of Obamacare, they don't need employer-provided insurance. They're able to get it either through Medicaid or through the exchanges. So those are all really good stories. And, again, if Trump doesn't kill it, I think, the program will survive. And again, we got to talk about making it better, covering more people and reducing the costs, which are too high. But that's, again, we have to first save it and then move forward.
I saw Dr. Bill Bronston nod his head to at least a part of what Dean Baker was saying there, so I'm thrilled to end this segment on that point of concord. I want to thank my guests, Dr. Bill Bronston, member of Physicians for a National Health Program, and Dean Baker, co-director of the Center for Economic and Policy Research. Thanks to you both.
Thanks.
Thanks for having me on.
And thank you for joining us on The Real News.